Governor, good afternoon. How are you?
Hi.
So you talk a lot about testing. Every week, and we've heard how the state's ramping up asymptomatic testing. Should anybody in Rhode Island be paying for a test right now?
Well, no, but asymptomatic. If you're not sick, insurance won't cover it. So if you come to the state-run portal, we will not charge you. But I know some people are going to other places, and unfortunately, some of these private labs and such are charging.
So that's the issue, is that somebody went to a private lab, they got charged $160.
Yeah.
They're in a situation, and we hear from the podium,
Yeah.
get tested, get tested, get tested. Sometimes it's not always available from the state, and then they have to shell out $160. You got millions of dollars that you've talked about allocating for testing. Is there a way for them to get reimbursed on that if they have to go to a lab?
Probably not, but they should just go to the portal.ri.gov, and it'll be free. And we are
always quick and accessible.
It is pretty quick and accessible, and it's getting better and better. I've heard these stories, and we've called and asked, but they're trying to make a living. I mean, make a buck, if you will, like some of these private companies. So what we're doing now is ramping up more of our free asymptomatic testing. We're going to add more sites. We're going to allow for easier scheduling, like self-scheduling. So I would encourage you to go with the state, get the word out, people, because this is happening. These private guys are charging. But I don't think there's a whole lot I can do about that.
One other thing, can you elaborate a little bit on the numbers for hospitalizations and your projections? Because last year we heard you're worried about the surge. You were kind of at the end of the flu season, and so you had, you put up 3 hospitals, you scale back on 2 now. Can you talk about what you're looking for December, January, February? Because what I hear from a lot of people is people are getting cases, but the concern is the overwhelming that we've seen in North Dakota and all those other places. What does it look like for Rhode Island at the limit, overspill? Can you give us some hard numbers on that?
Excellent question. Because that's exactly right. What I worry about is overflowing hospitals. So, a few statistics. On the dashboard that folks see, we doubled our hospitalizations in the past 3 weeks. That's not where you want to be. If you're doubling hospitalizations every 21 days or so, if you were to fast forward that, then we'll be out of space in our existing hospitals in a few weeks, like 4 weeks.
Specifically coming in because of COVID?
Yes, exactly. These are people coming in because of COVID, and yes, that's the right answer. So, but bear with me because I'll tell you. So we currently have 136 people in the hospital for COVID, which is just under half of the 300 beds we've designated for COVID. If our hospitals go into their maximum surge plans, that stretches capacity to, call it, 600 beds at the max. That's existing hospitals surged. We'll be at that in, call it, 4 weeks, which is when I'm going to have to open the Cranston facility, which has, I think, 325-ish, 325 COVID beds in Cranston. So that's exactly where we are.
From the equipment that you took down on the other 2, do you have that available to ramp up if you need to?
Yes.
Those other 2 sites?
Yes.
Governor, on the schools.
But I don't want to get there. So, yes, I'm prepared for the worst. But if we all make some changes now, we won't get there. Because as I said, that's 4 weeks away. Excuse me. They'd be 4 weeks away before we would be at our max 600 beds and have to tap into Cranston.
Governor, on the schools, as always, there's pushback on what you're saying in terms of spread. The latest numbers show that I think more than 200 of the overall 550-something cases of kids going to school were in the last week of data. So it's almost a third. Does that concern you at all? People are already pointing to that. There are 6 schools that have had more than 5 cases in the last week. So there's some pushback on the no spread. Schools aren't a problem.
So the cases are up. There's no doubt about it. Cases are up even in K-12. But still, and we are tracking it daily on it with the schools, still no evidence of wide-scale spread. Seem like you want to jump in.
And if I could follow up on Providence teachers
And again, sorry, Brian, here's the key point. So what's the solution? To send the kids virtually? COVID is just as prevalent in the virtual
There's 70
children.
cases in the last week.
Yeah, but it's still, I mean, we talk to the kids because we're asking them, who are your contacts? And they have a long list of contacts. And so they're not staying at home.
And sorry, just on the Providence schools, I know that the teachers say they're not being treated the same as other districts. We've seen Cumberland didn't have school yesterday because of a positive case among a teacher and his staff. LaSalle, now it's a private school, was out for a week because of cases where Providence teachers claim they have a lot of administration and staff who are out for quarantining reasons. They're short-staffed, and they're not going remote, and they should, mostly because of staffing issues.
So that's a better question for the superintendent, who has all the details of,
But
Providence.
the state oversees Providence.
Yes, but I'm saying if you want the precise details of every school, you could ask the superintendent. Here's what I would say. The decision to close Cumberland or any other school, that wouldn't necessarily have been our recommendation, to be clear, and I would like the doctor to speak to that. In many cases, we urge the school, go ahead and stay open. There's no need to close, right? There's no need to close if somebody tests positive. There's no need to close if a couple of students test positive. But out of an abundance of caution, or for whatever reason, that school decided to close. So I'm not, how do I say it? It's not necessarily that it was the right answer to close that school. And I don't think you can infer that because they did it, Providence should be doing it.
Right. Is the system working the way you intended it to and wanted it to in terms of when things close, when people take days off overall?
I would say, yeah, in some ways, yeah. Look, we have about 100,000 kids in school, going to school, some or all of the time. Overall, it is working. It is clearly working. We have, most of the kids in school, in person, systems are working. It is far from perfect. I told you, contact tracing is overwhelmed at the moment. We have to make some adjustments. The way we're doing testing, we're going to have to make some adjustments. So I'm pleased with where we are, but it's just like continuous improvement. Every day we begin and say, how can we get a little better?
Governor.
In regards to Halloween, will your restrictions on Friday, will that impact trick-or-treating or any of the plans?
I hope not. I hope not.
Secondly, in regards to cases per
But remember, trick-or-treating this year is before dark. It's before dark, no parties, with masks, not passing out the candy. So in that form, I think we're going to let it happen.
Okay. And Dr. Alexander-Scott, in regards to cases per community, we're seeing in Narragansett particularly, in the beginning of September they had 32 cases, and most recently, last check yesterday, they had 482. Is that because of college students? Is there a specific reason for the spike in that community particularly?
We are seeing increases across all communities. While there may have been certain pockets that got it started, the transmission spreads quickly when you have people who are not wearing masks. And that's really what we want to get in front of. The invisible spread that we're learning with this virus can happen in bursts and really go quickly. It can all be stopped by being able to wear a mask. So what we're seeing now in that community is not still just the college students, but is more a reflection of what we're talking about, guards down, masks being off. That's the key change we want people to do in their comfortable and casual settings.
Doctor, this may be a question for the governor as well, further to Brian's question. There's 2 Providence schools with 30-plus teachers quarantining right now. There's a few soccer teams that have shut down, and my question is around the state. There's cases all over the state from schools. But based on contact tracing, how many of those cases have translated into cases that don't show up in the school numbers? Someone's grandparent, someone's teammate in a soccer league that's not related to the interscholastic league. In other words, you're saying it's not a super spreader, but what are the numbers as far as spread that's coming from school situations?
We are clear about labeling cases as associated as opposed to cases because of school spread. We are not seeing significant in-classroom transmission compared to where we are seeing more is even cases that are associated with someone from the K through 12 community. They are oftentimes more so exposed in the community, either on the same team as someone, within their own household, or having attended some form of event. The school setting, the structure that occurs in the school setting, the distance that occurs, the mask wearing that's required, the hand sanitizer, and support the monitoring of that really is the difference maker in where spread occurs.
And contact tracing can effectively determine that?
Contact tracing actually helps us understand that there are so many different exposures. The example of virtual students that are also demonstrating cases, they're going to all types of different activities in the community. So it's clear to us that you cannot just say it's the school setting, particularly because that's where the most structure occurs. And you have individuals that are exposed to all of these other community settings that are unstructured, those 3 I's that we talked about. You know, indoors, inconsistent, and not being able to maintain the mask wearing that we know is needed.
Doctor, on contact tracing, what about those professions where people are interacting with so many people? I'm thinking of grocery store cashiers, many of us in the media who are interacting with people all the time. I mean, how do you effectively contact trace those kinds of professions?
It can be an extensive process, and that's what we're looking at, how to better adjust for that. You really see where there are scenarios where someone else may have been sick as a starting point to be able to help, and then also look at where someone is in an indoor setting with an inconsistent group and not wearing a mask effectively. That makes the chances of the spread higher in those situations. So those are the types of variables that we take into account as we're assessing.
And quick follow-up, and maybe this is for the governor as well. You're looking for more contact tracers. Where's the funding coming from to hire them?
That is through what has been budgeted for federal funds.
So that's coming from the fund.
Yes, so contact tracing, testing, all of that will be paid for. You know, we'll wind up spending over $250 million on testing, contact tracing, et cetera.
And Governor, a question about the field hospitals as well. I know 2 of the 3 were shut down. Is there a chance that those would be opened up again?
I'll say this. I hope not, because I think people will change their behavior so that we never have to get there. The convention center I had authorized to be shut down, and actually Director Smiley is in the process of finding contractors to take it down. The work hasn't started yet, though, and so if we need it, it's still there.
Doctor, given the trends that you and the governor have described in increased hospitalizations, increased cases, do you think that, and given that the governor said it could be 4 weeks before having to reopen these centers, you really think that increased mask wearing, a lot of people are wearing masks, you really think that that's going to make a difference? That can put the brakes on these trends?
Yes, absolutely do. People have been wearing masks well, following our focus and guidance, which was really out in the public settings. Make sure that you are masking, keeping your distance, that there are marks on the ground to help you be able to do that. The change here is now in those private, informal, comfortable settings, inside, informal, and in inconsistent groups, being able to wear a mask in those situations. That's really where we're seeing the source of spread. That will make a difference. I mentioned super spreaders or invisible spread. Wearing a mask inhibits each of those approaches.
So the spike is not a given.
It is not a given. It is something that we can impact. The data that was shared, if 95% of people wear masks, particularly in those 3I settings, we can save nationally 100,000 lives.
Governor, have you considered, or would you consider, a system like Massachusetts in terms of labeling each community as red, yellow, or green, and base restrictions per community? Because I hear some people say, well, we're out in a rural community, we're not having a problem. Would you consider a system like that?
Yes, we're looking at it. I have until now resisted it because Rhode Island is so small, so dense. You know, most of us live one place, we drive someplace else. So I wasn't sure if it made sense, and we don't have a county system. But at the moment, we are looking at it. I should tell you that, you know, this is real time. I'm reporting to you real time what's happening. We're going to go back and I'm going to go through all the data, look at all the options. I know I need to do something. It's crystal clear to me that if I don't impose new restrictions, we will be opening field hospitals, etc. I'm trying to figure out what's the smartest, most targeted, evidence-based interventions I can make that have the most limited impact on commerce. And so, long-winded way of saying yes, that's on the table.
Governor, would you consider this a second wave?
Yes. It would appear so.
Governor, what would the metrics look like? I remember it was probably a couple of months ago we talked about 100 cases per 100,000 when reopening schools, the green light. And you weren't sure at the time what it would take for schools to close and go back to distance learning. Is there anything concrete right now in place as far as closing schools?
We're using the same metrics that we did then. You know, we laid out then what the handful of factors that we would look at in deciding whether we should go backwards. So some of it is cases, but a lot of it is like operational readiness. Like, are they able to do the cleaning? Are the kids wearing their masks? Do they have their seating charts? Can we do the contact tracing quickly? What is the spread rate? So it'll be a whole, you know, all of the same factors.
Governor, one of the measurements of the greatness of society is the willingness in terms of great challenges to engage in shared sacrifice. As we witness the wholesale destruction of an already diminished private sector, we must accept the fact that shared sacrifice simply does not exist in Rhode Island. The bureaucratic arm of the public sector in Rhode Island has experienced few, if any, layoffs, furloughs, budget cuts, etc. After years of enjoying wage growth and employee benefits that are virtually non-existent in small private businesses. Meanwhile, funds allocated by the federal government for the support of small business are being held, ironically, in the event we cannot support government budgets. Meanwhile, the General Assembly continues to abdicate its oversight role while we spend millions to fund the General Assembly. When will the public sector begin to absorb the shared financial sacrifices that so many Rhode Islanders in the private sector have been forced to absorb?
Yeah. So the answer is they already are. There have been layoffs, I think, in almost, I shouldn't say every, but most cities and towns. And I'm sure more to come if we don't get a stimulus. We've had a hiring freeze for months. We're looking at furlough days right now. We've stopped spending substantially to tighten our belt in state government. But here's the reality. Two things. One, laying off state workers, like, we're like serving the crisis right now. If I were to lay off people of the Department of Health, or the way I've found 50 more contact tracers quickly is by pulling from other areas of state government and having them do contact tracing. So not only would it hurt our ability to respond, it would add to the unemployment rolls. But here's the real point, which is most of what government spends isn't on people. It's on providing health care, on providing services, on paying for nursing homes. And that's what I'm trying to preserve money for in the event that we don't get another stimulus, because the way that we'll have to find cuts will be cutting school budgets, cutting nursing home budgets, cutting hospital budgets, and that's what I would like to try to avoid.
Governor, just one follow-up. I was focusing specifically on state government. I'm aware that a number of small communities have been forced to engage in budget cuts and have been forced to engage in layoffs. But when I look upon a $10 billion budget, and I look at, for example, the Department of Administration, which has experienced significant growth in plus six-figure salaries, I look at quite frankly, the public relations budget in this state. I look at millions of dollars.
State government is down about 1,000 employees in the past 10 years. Rhode Island has among the lowest number of state employees per capita in the country.
I would point to states like New Hampshire, but again, the general point is we spend millions to Twin River. We give millions to a General Assembly that's not even functioning at this point, and there's no oversight. Again, it's about the perception of shared sacrifice. State employees at the bureaucratic level, and I'm not trying to cut essential workers here, but at the bureaucratic level, don't have to face bankruptcies, don't have to face running out of unemployment benefits, don't have to face business closures. I understand that people are working hard and they're tired, and no one wants to see anyone lose, but there is no shared sacrifice in this state. And that's the perception.
I hear you. Listen, I hear what you're saying, that people are going bankrupt and people are struggling. And I'll just say that we are tightening our belt too, and absent a stimulus, there will absolutely be furloughs and layoffs and cuts. And I actually think that'll be devastating, a whole lot more than shared sacrifice.
Governor, just one more follow-up on schools. Given the numbers you had talked about, minimal spread, and you wanted to get people in there, I had told you and the commissioner 3 or 4 weeks ago we had that cold snap, that parent from Exeter, West Greenwich. His kid's on the bus for 45 minutes. Every single window is open. He just emailed me again. It's pouring rain. It's cold. It puts his kids in a miserable mood. What is the science behind leaving every single window open on the school bus?
I'm not doing that pretty good.
Yeah, one of the things that we're seeing is critical with this virus is having adequate ventilation. There's a variety of ways to achieve that, but because of the ability of the virus to increase its virulence or ability to spread in environments where the ventilation is poor, indoors, people are crowding. A key component is paying closer attention to the ventilation. We're aiming for air circulations per hour being more than 4 to 6, and have learned a tremendous amount through this pandemic response about the virus and the need for the ventilation.
Well, I appreciate all that. Would you not agree that sitting in a stagnant classroom with a couple of windows open is different than a bus going 30 or 40 miles an hour? And can you give a little bit and say you don't have to have every window open on the bus?
You know, can I?
Absolutely.
I think you're hitting on something I think is really important, which is like the practical reality of how this messes with people's lives. So I'm going to get you a good answer. I can't do the math up here on the stage without embarrassing myself, but there is an answer to your question, which is to say, figure out the cubic volume of that bus, how many times you need the air to turn over in an hour, and roughly how many windows do you need open by how many inches? And I'm going to get you that answer by the end of the day.
I'll look forward to that.
Doctor, Governor, one question for the doctor. You spoke eloquently about the scourge, if you will, of the opioid crisis and related drug crisis here in Rhode Island. Is this at the point, given the resurgence of that, despite heroic efforts to distribute Narcan, training, advice, is this the time, if you will, as the recovery community so desperately wants to consider either decriminalization or legalization of most substances and to follow the Portugal model so that we can finally get out of this vicious cycle that you alluded to?
Harm reduction is an absolute necessity in how we're approaching it, and what you asked about is one of those models. It's absolutely the time to put everything on the table and really assess. We had last year one of the ministers of health from Portugal come speak with us so that we can learn more. We've been engaging with the community to determine what are the steps that we can take to make the difference.
Last question. Governor, on another subject, earlier today, Massachusetts Governor Charlie Baker nominated a woman of color to be Chief Justice of the Supreme Judicial Court. You have one opening on the state Supreme Court, possibly another in short order. Does this influence your decision as to whom you may choose, and would you commit to choosing a woman of color to the state's highest court?
It does not influence my decision, although I was very pleased to see that. I will not commit to that, but I am committed to diversifying the bench. I will note that every single person of color in the Rhode Island judiciary is a judge that I appointed, and I would love nothing more than to continue that track record. So, you know, as always, I will get the list, I will interview everyone, and I'll pick who I think is terrific. But I haven't done the interviews yet. I have not done the interviews yet. I just got the list. I'm going to get to doing the interviews in the few weeks, and I'll make my choice. But diversity and equity is the top priority. See you Friday, 1 o'clock.